Hey everybody, I'm Dr. Alicia and this is Dr. Sarah, and we're here from She Found Health. We're family docs in beautiful Victoria, BC, who specialize in maternity care, and we work at a clinic called Grow Health.
So Alicia and I are doing a series of videos covering a variety of topics around labor and delivery. Information that will be covered in this series will include when to call the doctor and or go to the hospital, early labor and comfort and support measures that you can do at home, active labor, including comfort measures in labor, both supportive and medical treatments, second stage of labor and interventions that are sometimes required and why, cesarean section, forceps, vacuum, things like that. Next, we'll talk about postpartum and what issues to expect, including at the hospital and at home. Lastly, we'll talk about normal postpartum adjustment versus postpartum depression, anxiety, and when you should be concerned.
So if these topics sound like they're of interest to you, then make sure you hit the subscribe button below. You'll get notified when we have new content, which we're trying to put out regularly. Also, check out our website at www.shefoundhealth.ca. There's tons of great info. We've got some blog posts, and we're actually going to be coming out with an online prenatal class very shortly, so you can do it from the comfort of your own home. Make sure you also read our medical disclaimer at the bottom of the show notes, please.
So, let's get into our first topic.
Yay!
Woohoo! When to call your care provider or go to the hospital. So, reasons to go to the hospital when you're pregnant are many. Generally, if you're preterm, which we define as under 37 weeks, we would like to hear from you before you go to the hospital to talk about what you're experiencing. Things that we would want to hear about before you go to the hospital include
if you're having any regularity to contractions before 37 weeks. So what we define as that is every 5, 10, even 15 minutes that are lasting for more than an hour or two and or getting a little bit more intense. We really want to hear if you're experiencing those so we can figure out how to manage you best. So all of your care providers should have an on-call number, an emergency number that you can call. This would be a reason if you're less than 37 weeks, i.e. preterm, to give your care provider a shout.
And we should clarify that that's painful contractions, not Braxton Hicks.
Correct. Braxton Hicks feel like more of a tightening. They're not usually painful or very mildly uncomfortable. Sometimes you can feel like a little bit of a catch in your breath when you get them. But certainly what we're talking about, Sarah's right, is painful contractions.
The next thing we would want to hear about is if you're having heavy bleeding, particularly if you know that your placenta is low-lying or you have something that's called placenta previa, when your placenta sits right over the cervix, which is the opening into your uterus. You would have been told by your care provider if you had either one of these. So if you're at home and you've got some bleeding that's ongoing, lasting for more than 30 to 60 minutes, you have a large gush of blood, or you're soaking a pad in less than an hour, we want to see you. If you're having some spotting that then turns brown, you can let your care provider know at the next appointment.
And certainly it'll also differ as to how far along you are. So if you're having spotting after 37 weeks, or you're having a little bit of bleeding, but you're having painful contractions, that's usually just normal. We call that bloody show. Your cervix changing. But if you're having those things prior to 37 weeks, please do give us a call.
I always tell women in pregnancy, there's no such thing as crying wolf.
No.
Nope.
Trust yourself and your intuition.
Yeah.
It's very important. So the other reason we want to hear from you is if, again, you're under 37 weeks and you think you've broken your waters. So sometimes it's a bit hard to tell whether you're peeing your pants a little bit or you've broken your waters. That's okay. Happens to the best of us. But usually breaking your waters will feel like a little bit of a gush, or every time you stand up, you feel a little bit of a trickle. So certainly if you're wondering about that, give us a shout and we'll try to figure it out over the phone. If not, we'll see you either in the clinic or in the hospital to kind of make sure one way or the other what we're dealing with. The other reason we need to know if you've broken your waters after 37 weeks is if you're group B strep positive. So most of you should know if you're positive or negative. And if you're positive, we need you to come into hospital because we need to start those antibiotics that we've talked about in the past. So again, if you're group B strep positive, either come on in if you're over 37 weeks and you think you've broken your water, or give us a shout and let us know.
Another good trick that we often tell people, if they're not sure that they've broken their waters, is to put a pad on and leave that pad. If you're constantly soaking and having to change it, that's more likely.
Yeah.
A lot of women do have a significant increase in vaginal discharge around term and often think that just the discharge alone is their water breaking, but that shouldn't constantly be wetting your pad.
Exactly.
So that's another trick you can do, and chat with your care provider if you're concerned.
And we can also use that wet pad to test to see if it's more likely to be amniotic fluid or not. So certainly if you are coming into the hospital, put a pad on before you come.
Another reason we would want to hear from you is if you think your baby's moving less than normal. So we call this fetal movements. And you should have been counseled sometime in the 3rd trimester of your pregnancy what normal fetal movement is and how to count for it. So we define normal fetal movement as 4 movements in 1 hour or 6 movements or more in 2 hours. And what we mean by a movement isn't 1, 2, 3, 4. It's baby moves, a few minutes later, baby moves again. So if you...
Sorry, the 1, 2, 3 punch?
Yeah. So if you are at home and you're not sure your baby's moving, we don't need to hear from you immediately. What you need to do is lie down.
Sit down.
Sit or lie on your left side. Put a hand on that tummy. Have a bit of a snack. And then count. See if you can feel your baby moving. If you still think you can't feel your baby moving after 20 to 30 minutes, we would want to hear from you. If you get to 20 or 30 minutes and your baby has moved 4 times, you're done.
Yep. I usually say in 2 hours, 10 movements in 2 hours. Because those babies do have a sleep-wake cycle. So they can sleep for 45 minutes and then wake up. So 20 to 30 minutes may be a little bit
short.
Yeah. But at least an hour at least. Just have a good listen.
Yeah.
Or a good feel of your baby.
Yeah. And what I mean by that is you don't have to do it for the whole hour if your baby's already moved enough after 20 minutes.
Correct. That is true.
And really, I think what's important for people to understand, if you're watching this and you're only in your 2nd trimester, don't worry about fetal movement counting. We don't really counsel women to start doing this until well into their 3rd trimester.
Yeah, 28 to 30 weeks is when we should get a better sense of how our baby moves, which is going to be different than other babies, and that's fine. So that's when we start to be a little bit more aware of that regularity of movement. So the last reason that we want you to call us if you have concerns is if you do break your waters before or after turn, if that amniotic fluid is brown or green. That just means that your baby's already had a poop in its amniotic fluid, which is incredibly common and generally speaking not worrisome. But sometimes it can be a sign of baby in a little bit of distress. So we want you to come into hospital so we can have a good listen to baby and make sure baby's moving well and is doing okay. Now, again, if you're preterm, any rupture of membranes, we want to know about it. If you're after 37 weeks, we want to know if you have group B strep positivity, if there's lots of bleeding associated with it, or if the color is green or brown. If you've broken your waters, your term, your GBS negative, the amniotic fluid is clear or mildly yellow, it's okay to hang out at home as long as baby is moving. 1, 2, 3, punch. If they're doing that, we know they're doing well. So give us a call at a reasonable time of the day or evening. Let us know what happened, and we'll talk to you about next steps.
The other thing I often tell women, sometimes you call us and we're not available because we're in a delivery. That can lead to a bit of heightened anxiety. Here locally, you can also call the labor and delivery unit. The nurses there are able to give tons of advice over the phone and can give a bit of counseling as well. So if you can't get a hold of us and you're starting to worry, it may be over an hour before we call you back if we're in the middle of a surgery. That's okay. Call the nurses. They can give you great advice.
Yeah, so find out what your local number is from your maternity care provider, and they can certainly give it to you. So I think that is a brief description of when we would want to hear from you. Certainly, if you have any other questions about logistics, talk to your care provider about when they specifically want to hear from you. But hopefully that was helpful and that you enjoyed that video. Again, if you found it useful and you want to see other videos, subscribe below, and we'll post a couple of other videos that'll link to this that you might find interesting as well. So have a great day.
Take care.